Number one, does getting the right counseling affected by such things as if you have OCD or ADD?
Does the right kind of counseling?
Yeah, I presume that the member's asking if you're afflicted by those things, is it hard to get good counseling, or will counseling help it or hinder it perhaps?
No, counseling will not hinder it. I would
You're
say,
breaking up, Micah, you're breaking
yeah,
up.
yeah, sure. So I first of all, something like OCD and ADD, these are meaningful conditions and they do different things. So one is choose a counselor or a therapist who understands OCD and ADD, which are, we know a great deal about these. And I'll suggest one thing. For example, OCD, what drives OCD is covering up, controlling anxiety, controlling the unknown. So even though we view it as some sort of a pathological condition, it's a disorder, etc. To me, it's an attempt to create structure. So OCD creates structure. Structure reduces anxiety. But at one point, there's so much structure where you can't breathe anymore. The structure has become too rigid, limiting, etc. So I would not go to someone who wants to get rid of my OCD, but to help me understand it and add more flexibility to it. I think there are wonderful ways of, effective ways of treating OCD. Again, the last thing I will do would be to get rid of it. That is the wrong way of looking at it. It's doing something. OCD is giving you structure, but loss of flexibility, that's what breaks us. So loosen up, the structures that OCD, see what's behind it. What are the anxieties? Anxiety that triggers the obsessions and the compulsions, of where did it come from, etc. So someone who is safe, someone you can trust and build a relationship with, a therapeutic relationship with, and then gradually you can address, work around the OCD and be able to talk about, things that are overwhelming you, bothering you, etc. So emotional expressions, being able to say I am frightened, I'm sad, I'm upset, being able to say it and being safe while you're saying those things. I assure you, when people leave the therapist's office, they may not feel any kind of relief, but later that day, there's like, I feel better. It's like some offloading. And in time, you'll be able to see things differently. I would say with burnout specifically, you need to change your perception. One needs to change his or her perception of stressors. That if I make a mistake, that's the end of the world. That's that level of just catastrophizing. It needs to be confronted. Or 5 patients said, I was great, and 1 patient said, I'm still hurting. And just remembering that for the rest of the day, that would be more of a polarizing, it's a good and bad, and filtering out all the positive messages. So those are the things that one can learn to recognize and work around them. So there are lots of things you can do. ADD, it's a very, very complex phenomenon. If you look at the actual physiology of ADD, you will see that the brain is actually falling asleep. And the brain is actually it's being mesmerized and it's trying to fall asleep. So you have to kind of stimulate yourself to become more alert. And one way is to come up with ways of, like what I was saying, rearrange your office, rearrange what you're doing. So you're not in that automated mode. Just change things around so that you can be stimulated. There are ways of treating ADD physiologically. We want to raise a little bit of a dopamine in the brain, norepinephrine in the brain, etc. If you use properly, we can treat it in that fashion. But learning to stimulate oneself and recognize when you're trapped in that automated mode will help you cope with symptoms of ADD. These are treatable. These are treatable. ADD and OCD, these are, to me, these are minor when it comes to burnout.
Question number two. Question number two, is there any connection between burnout and chronic pain?
Yes, absolutely. Well, pain is a massive stressor. So pain can deplete your resources and move you toward a state where you cannot properly cope with the situation around you. But the reverse, the way the questioner asked that wonderful question is, yes, burnout. One of the symptoms would be depletion of a reduction in the activity of certain neurotransmitters, particularly norepinephrine and serotonin. And when these levels are low, we become achy. And when lack of sleep occurs, we further become achy and overall pain, etc. And that excessive production of the glucocorticoids will actually move us toward arthritis. Arthritic changes begin to take place. So yes, absolutely. And the brain begins to rewire itself. So pain becomes a way of withdrawing from demands in a maladaptive way of coping, etc. But yes, long ago, there was a physician, American physician by name John Beard, late 19th century, coined the term neurasthenia. And neurasthenic people had achiness, fatigue. It's still in the ICD classification. You can still find it. They use it more often in Europe than we use it around here. And one of the symptoms of neurasthenia was achiness and pain. So pain, chronic pain, remember, your neurons firing like crazy, glucocorticoids are pretty much breaking down, doing all kinds of damage to your musculoskeletal system. Yes, it will set the stage for chronic pain, no question. It won't cause it, it will set the stage, but gradually there's erosion of tissue that can contribute to it. Absolutely. So just imagine, the whole day I want to say, I don't want to do this. I really don't want to do this job, but I have to be quiet because everybody's counting on me. I have to bite my tongue, etc. You see the tension in the muscles of the jaw. The mandible is like frozen into place because I can't express myself. I've actually seen this physically when people are finally able to express. Before you get there, you write down those emotions on a piece of paper. It's a lot easier sometimes to express them until you're able to actually say them out loud. Oh my God, that felt so good. And being able to cry actually is a source of great healing. Your endorphins go.
Great, thank you. Next question's a fairly complex one. I'll try my best. Is the way that a person feels differ if you've experienced grief versus betrayal? I get the sense that grief originates from the outside, while betrayal may originate from the inside. That must bear on how we feel and how it would be treated. Do you want me to repeat that?
No, that is a profound question and with far-reaching implications in terms of what betrayal does to us. So grief is loss of an object being a person, source of support at the moment, and it's very difficult at times to cope with it, but something has come to an end, and maybe inevitably due to an accident, age, etc. There's an experience of loss. Betrayal is viewed as an assault, and an intentional thing that somebody has done to us, and there's a memory of that. That's why it needs to be reconceptualized. that and the beginnings of talking about betrayal is extremely painful because it has almost PTSD qualities about it. It does actually have PTSD features. And so you treat it very differently. Grief is treated very differently than betrayal, for example. Um, Grief is accepting what's happened, going through the stages of death and dying. But there's a denial, there's bargaining, there's anger, depression, acceptance. Betrayal is an assault. It's an intentional assault inflicted on a person, and so to reframe that, reconceptualize that's a whole different way of looking at it. Betrayal often results in the inability to trust others, because what if they will do the same thing? So we build this thick wall around us, so that, and then we suffocate inside of it. So those are really difficult things. But thank you for that profound question. They're very different phenomena.
So the question is, I
Hi,
don't know if
Paul.
Micah, hi Micah, how are you?
Thank you. Good to see you.
There you are. You may not know, but at least in our part of the world up here, because of COVID, all these, well, the psychiatrists are all busy. Everybody's too busy, overloaded with patients. This is an odd question, but as a psychologist, if we're stuck and we want to get someone to talk to, is a social worker, do they have the kind of training that allows for that? Because we have just general practitioners who take a few courses and then they're even doing counseling. So just wondering what, anybody can't do it. But what are social workers? Are they an option? Because we have cost factors and we have availability factors.
Paul, that's an excellent question. And I absolutely sympathize with what COVID has done to us, and the way we cope, etc. So I'm almost certain this applies to your country as well. But you can put social workers under two classes. One is people who go to people's homes and they do agency work, and there are some wonderful MSWs, Master of Social Work, who are licensed therapists or actually licensed psychotherapists, and there's a large number of those around here. I know in New York City, there are many social workers who do psychotherapy alone. I appreciate that there are more and more counselors out there, and counselors can help with adjustment, etc. If it comes to burnout, I absolutely want, this will be my suggestion, a seasoned psychotherapist, and also I want you to have access to a psychiatrist, and for one reason, because as I showed you, later stages of burnout, we may have to use antidepressants, and we have really good antidepressants. It's not long-term, but if you effectively use antidepressants, you can actually make a huge difference. A week ago, I gave a 2.5-hour talk on neurotransmitters and psychopharmacology of sleep. But somebody knows how those neurotransmitters work, and psychiatrists do, and communicate with the therapist or social worker, etc. That can make a huge difference. I can't emphasize enough how important it is to find a good psychotherapist, whether they're social worker, counselor, clinical psychologist. I would definitely reach out to them and ask them. You want someone who's educated, understands the I'm not practicing. I just too busy doing teaching. Teaching has just consumed my days and night. So I give lectures to psychologists. They invite me twice a year to their group, so I talk to them. But I would. We have a Pennsylvania Psychological Association. They actually can give you a list of who's has good credentials, etc. I wouldn't use the necessarily all the time go after like Googling things, etc., because that has a lot of nonsense, junk information in it. Word of mouth will be much better. Talking to your physician will be much better than people exaggerating what they're doing, etc. I would be a little careful about going to a psychotherapist that just has placed a bunch of things online. Word of mouth will be excellent. Colleagues, friends, family who have seen a good social worker, psychotherapist.
You can wait a year to see a psychiatrist here, if there's even one available.
Right. I'm thank you so very much for your ongoing commitment. This was a topic that we wouldn't have thought of doing, and I think it's provided valuable support. And you need to know every member of this academy will have access to this to view in their privacy of their own home as many times they want. So thank you so much for enlarging an area of education that we probably weren't aware of and probably needed more than we thought. So on that note, thank you for coming back to Canada. We'll talk and we'll have you back soon. Thank you, folks, for supporting our academy. Thanks to Bianca for all the hard work she does. And we'll see you in a week.